Infectious disease specialist Dr. Zain Chagla joins us this morning with the latest on vaccines and COVID-19. Good morning.
Hi, good morning.
I want to talk about hospital and ICU admissions because they are creeping up, and we keep, everybody's watching the daily count numbers every day that come from the province, and we notice that they're really high too. But does this mean that things are as bad as they were at the height of the pandemic?
No, I mean, I think there's a big difference here, right? There are, on the one side of things, 75% of the population that's fully immunized, and they're very unlikely to end up in the ICU, even if they get COVID-19, and their likelihood to get COVID-19 is dramatically reduced. But on the other end of things, that 25% of the eligible population is still getting COVID-19, and in fact, in much higher numbers than they ever have before. We are getting data out of here, out of Singapore, and in Scotland, where these people's chance of hospitalization is much higher than before. And so, yes, we are seeing a disproportionate representation in hospital of people that are unvaccinated, and in the ICU of people that are unvaccinated. The good news is that the 75% of people who did get fully vaccinated are not being represented there, or very minimally, and often for other reasons. So it is a good news, bad news scenario, but it really is to say that 25% who is unvaccinated is incredibly unprotected now and really needs to consider getting the vaccine moving forward.
And healthcare workers could tell you that, right, by the number of people that they're seeing in hospital and the degree of their illness.
Yeah, absolutely. Look, the profile is still sometimes the older person with comorbidities, but we have all seen people who we did not expect to be that sick that got that sick. People that are under the age of 40, people with absolutely no medical issues, people that are, more in shape than many of us, that are, ending up on ventilators. They may not die, and that's, partly because of their illness and the fact that they're healthy before. But they, have long stays, and they're fundamentally altered when they come out of the hospital. And again, this is a preventable disease in the context of having a vaccine in beforehand.
Because you're hearing about, of course, there's the cost and the overburdening of our hospital system, but there's also, we're hearing about lingering effects like months and months and months later, and we really don't know how long the effects could last.
Yeah, absolutely. Look, we are seeing people that are not well even after their hospitalization, their ICU stays. There are people that have lung scarring after their ICU stays where they may not have, or they may need a lung transplant down the line. We've transplanted a few people already who have had severe COVID-19. There are people whose sense of smell and taste don't come back, and it is fairly altering. There's people with fatigue to the point where they can't work. And so, again, all to say, if you could do one thing to mitigate your symptoms and make them much better in the context of getting COVID-19, it would be getting a vaccine. Even if it doesn't work perfectly, if it doesn't prevent you from getting COVID-19, the symptom complex is much milder, and those lingering symptoms are much lower if you've had a vaccine in your system versus not.
I want to go into a number of recent studies that have shown too that women who were vaccinated when they were pregnant have passed along some of the antibodies to their children.
Absolutely, and this is not an unknown concept, right? The way children are protected in the first 6 months after they've been delivered, as their immune system is starting to mature, is largely based on antibodies given from the mom to the baby during the last trimester of pregnancy and during breastfeeding, and some of the breast milk also has antibodies. So we normally immunize women for tetanus and diphtheria and pertussis in the third trimester. We give people influenza shots during the pregnancy if it's influenza season, with the hope that it not only protects the mother, but it actually gives the baby some partial protection for a few months. So again, another good reason we are seeing no difference in pregnancy outcomes in women that are pregnant getting the COVID-19 vaccine. We are seeing very bad outcomes in pregnant women that get COVID-19 that are unvaccinated. But on top of that, there is this concept of protection for the newborn that is well known in infectious diseases that may be helped with a vaccine on its own.
Okay, another reason to go and get your shot if you haven't already, because it could be mandated where you live very soon.
Absolutely.
Okay, Dr. Zain Chagla, thank you for joining us again. Stay well.
All the best.
Okay.